we implemented in the first round with three work groups. One was with sort of aged care, another was an outpatient clinic, another was a hospital, inpatient unit. We just did the program as it was laid out that way. And we would meet before and plan out the next session and debrief the previous one and plan out the next session. And see, we were working with it very much hands-on that way. So, and they basically, the groups, we had the pre-measures that showed, we did a larger survey. So we knew sort of what the metric was for our measures within the larger hospital. So we could see these groups we were working with, one, they had problems, that was from the evidence, but also they had a very high participation rate in the pre-survey. It was one of our markers. If they don't do the pre-survey, we're not going to do the implementation because that's the easy part. That's the easy part. And so you needed a good participation there that they really wanted to do this. And so we had that with these three units. And we were able to show that basically they went from, definitely subpar relative to other groups on civility and aspects of the burnout scale to being slightly above par at the end of the process. So that had made this real difference over the, I guess about 4 months it took to implement the program that way. And so we then ran a second go round with three more units and a second go round there. And again, we found that kind of similar kind of impact that way. So we were going along there and then looking forward to doing more. And then we started running into 2020 and everything sort of went off that way. But basically it worked very well. We had people, again, the units and the unit managers actively, we informed what this was. I went and did some talks with them and they, so they decided they were going to participate in this. It wasn't assigned to them in that way, but they decided to get on. And so it worked. And then during the pandemic, we have worked with some other healthcare institutions in doing it online. So we've done the Zoom version of SCORE as well, and that has happened too. So it, the process, it sets up and it goes. Yeah.